And legislation aimed to limit transgender athletes and restrict gender-related health care for minors is up for debate in Jefferson City. Our Missouri Chief Capitol Bureau reporter Emily Manley has more on the topic that is the headline of the legislative session. Emily?
Well, Mandy, you might remember that last month I reported that the Senate passed some legislation regarding this same topic. It would ban gender-affirming care for minors, and it would also require transgender athletes to compete on the sports team that matches the sex on their birth certificate. Well, today the House took up its own version, and it's more restrictive.
Consider what this does to these families and to these kids.
After the controversial topic stalled the upper chamber for days, representatives gave first-round approval to its own plan.
Sex changes in kids are two things that shouldn't go together.
The legislation would prohibit doctors from performing surgeries or prescribing puberty blockers or hormone treatments to minors.
But we should not be making laws that target one population because you don't understand them.
The Senate's compromise allowing current patients to continue with treatment once the law goes into effect. And there's a 4-year expiration date on puberty blockers and hormone treatments. But those exceptions are not in the House's version.
Now, there will be a delayed effective date. We're shooting for about 6 months on that. That's a reasonable off-ramp for children that are on some of these drugs. We want to get them off of those as quickly as possible.
Those in favor say they are protecting kids.
Do we in this body want to allow children with a mental illness called gender dysphoria to decide to permanently sterilize themselves?
The House also discussed restricting transgender athletes to play on the sports team aligning with the sex on their birth certificate.
Kids deserve to feel safe and not that their government is attacking them.
According to the Missouri State High School Activities Association, there are 8 trans student athletes who have been approved through their policy, 4 competing at the junior high level and 4 at the senior high level. Now, both these bills need one final vote from the House, which could come later this week. If they are approved, then they head over to the Senate. Last month, Senate President Caleb Rowden said that if any changes are made and their legislation in the House is different from what the Senate passed, he doesn't expect to get any bills regarding this topic to the governor's desk. Mandy?
And that would be very interesting, Emily. This is certainly a topic that has overshadowed this session. At this point tonight, where does this stand in both chambers?
Well, Mandy, we only have about 5 weeks left in session. And actually at this moment, at this exact hour, there's actually a committee hearing going on right now in the basement of the Capitol. It's a House committee hearing, but it's actually regarding those Senate bills that I'm talking about. It makes it a little bit more messy because we have the Senate version and we have the House version. And as you heard, they're both separate. So it's really the only way possible, I think, to get it to the governor's desk is if the House approves the Senate version without making any changes. And as I said, there's only less than 5 weeks left to see if it happens. So I think these last couple of weeks are going to be really interesting to see what happens regarding this Republican priority that they want to pass this session.
Yeah, it's coming down to the wire, and it's a topic we've been hearing about week after week. Emily, I know you'll continue to stay on it. Thank you.